We're a minute late. Yes. So is everybody on? It's going to be? Thank you and good afternoon and welcome to the February 11th special meeting of council. The city of Parksville recognizes the people of the Coast Salish nations and their traditional territory upon which we gather with gratitude. I'm going to start here with a little bit of an introduction, if I may, and then we'll go from there. So bear with me. First off, I want to thank everybody for attending this meeting regarding this very important issue. This issue was brought up by the citizens of Parksville very loudly, and it's not something we just threw up against the wall to see if it would stick. I personally have received numerous calls, emails, and had many discussions from Parksvillians who are concerned about discarded needles. I know most, if not all of my fellow councilors have been confronted by this issue as well. Contrary to what was previously stated, we have had needle pricks in town. As a matter of fact, we are aware of at least 4, including a couple of children. And no matter what, 1 is too many for that to happen. The problem is that it's also an embarrassment to the community when it comes to tourism. For example, each beach volleyball event, the teams get together and go shoulder to shoulder across the courts to ensure needles aren't laying under the sand and unseen. Throughout the city, there are regularly found in business doorways or in alleys, needles. It is such that we actually have a hazmat company on call to remove larger numbers when they are located. We've been attempting to have a positive effect on this situation. We developed what we considered to be a reasonable recommendation, only to be shot down with the comment that it was against the province's harm reduction program. So one of your representatives stated back 2 years ago that it was not a real big problem, and they cited this on the radio, and that only 2% of the used needles are not being returned. And part of my concern is how we would know that, because Island Health has told us that they have no way of knowing how many needles they give out. So if you don't know how many you're giving out, how do you know that 2% were not being returned? If you look at that from another perspective, just from the numbers that our staff are finding in the city, you would have to be distributing tens of thousands of needles each year in Parksville in order to make that 2% calculation work. We did talk to the minister, and to his credit, he didn't wade in deeply into this discussion. We had a very open discussion about it, and he suggested, and it was a very wise one, that he would set up a meeting with the deputy minister so we could discuss the technical aspects and the differences we have. We wanted to discuss the fact that the Ministry of Health's own brochure on harm reduction very clearly states municipals can exert influence on policy in areas such as public and community health, housing, social services, community safety, recreational services, development and zoning, licensing and bylaws. This is exactly what we wanted to do. It goes on to say, the pamphlet that is, goes on to say that on a practical level, the purpose of harm reduction is to reduce the immediate harmful consequences of drug use through pragmatic, realistic, and low threshold programs. More widely known harm reduction strategies are needle exchanges, methadone maintenance, treatment outreach, and education. These are your words, not ours. It says even further that harm reduction benefits the community through substantial reductions in open drug use, discarded drug paraphernalia, etc. I'm not sure how our proposed bylaw does not only meet those objectives, but certainly in fact goes even further than anything we have seen from the province when it comes to discarded needles. At no time was the purpose of our bylaw meant to reduce the numbers of needles being passed out. Our purpose was that the distribution be done not only for those with addiction issues, but for the safety of our residents. I could continue to quote your own pamphlet and point to other objectives, but I think we all wish to get on with the conversation. And so let's talk about that. We believe that our bylaw is not cast in stone, but we need to be convinced that your program can handle this problem in a better way. And that's something we're looking for. I mean, the idea is that we want to make it safe for everybody. We need to make our city safe for our 13,700 residents and the tens of thousands of tourists that visit us each and every year. So we've been looking forward to this discussion for quite some time. I can tell you that the problem is not getting any better. Last year, our staff collected double, 2 times the amount of discarded needles than they collected the previous year. And our hazmat company that we contract to was called out 7 times to pick up larger collections of used needles. I promise we will maintain an open mind in our discussions today, but we ask that you do the same. We are the ones on the streets and at the beaches, and we are the ones that have to explain to our constituents why the problem can't be fixed or why it has taken 2 years to get this far. With that being said, we're very happy that you're here today, and we welcome you, although it's virtually, as most of our meetings are these days. We can talk about this very important issue, and perhaps we could start the meeting off with a round of introductions so that we all know who's talking. And let me start by introducing my counselors or our counselors. So, and then after that, I will turn it over to the Deputy Minister. So on my right is Councillor Teresa Patterson and Councillor Marilyn Wilson, Councillor Doug O'Brien. Joining us online is Councillor Adam Fraz and Councillor Mark Chandler. So we're all here, and Deputy Minister, if you could introduce your party to us. You're muted.
There
we go.
There we go, yes. So thanks very much, Ed. Pleased to be here and really appreciate your words and looking at some opportunity to try and find some common ground in the interest of everybody, as you just said, in terms of both the residents, the visitors, as well as the individuals who we're trying to help. So I really appreciate those words. Myself, I'm Steve Brown, the Deputy Minister of Health. With me here today is Christine Massey, who's the Deputy Minister for the Mental Health and Addictions Programme Ministry here in BC. Online as well, here is Kathy McNeil, who's the CEO of Island Health, as well as Leah, who's joined us, who's the Leah Hollins, who's the board chair of Island Health. And then in addition, we have got Kenneth Tupper, who works at the Ministry of Health, is online, Garrett Vanderleer, also with Ministry, and then last and very much not least, Sandra Allison, who's the Medical Health Officer, who's with Island Health. So that would be the team on this side. And I know we're really keen to have a good discussion and see exactly as you just said, Ed, can we find a way to support and help and work through the issues in the interest of everybody, not just one party, but in the interest of everybody, and see if we can find some solutions. And I know Kathy at Island Health team, I've got some ideas that they wanted to discuss, as well as Christine's here as well, to kind of contribute with the rest of the team. So yeah, so we're good to go. And I don't know whether do you want to move into, and I could hand it off to, I think, Kathy and then Sandra are going to kind of say a few words and get the discussion going, if that works for you.
Sure. Just one quick point, if I may, just to make life a little bit easier and not so formal. For today, let's drop with the formalities and it's all first name basis for everybody. Would that be all right with anybody? Would we offend anybody by doing that today? All right, let's do that. All right, so please go forward. If you would start the conversations, we would appreciate it.
Great, thanks very much. And having broke the formalities at the beginning, apologies for that. So thanks for that. Thanks for that, Ed. Okay, so I'll hand over to Kathy and then we can go from there. Thanks, Ed.
Thanks, Steve. I just wondered if Christine from Ministry of Mental Health, did you want to say anything in terms of your ministry before we get into the actual operations here?
Certainly. So I can say a few words. First of all, thank you for having us here. And Ed, I did appreciate your the open mind, and I can assure you we're also bringing an open mind, and I think we are all looking for a similar outcome and hoping we can find a path there. So just to let you know a little bit about my role, I lead Ministry of Mental Health and Addictions, which was the first in Canada to be created a number of years ago. And our role is to work across government, knowing that the issues of mental health and addictions affect so many aspects of life, from schools with children and youth through, of course, health authorities in the health system, but also corrections and also with housing. So we've been working with our colleagues across government to expand services. Of course, we know more is needed, which is partly why we're here today. But also want to say on behalf of my minister that she recognizes the impact that untreated mental health and addictions can have on communities, and that really underlies part of the mandate that we've been given. I think that's illustrated in part by the fact that my minister chairs a cabinet working group with her colleague, the minister responsible for housing, dedicated specifically to mental health and homelessness, because of the impact. We've all heard about the impact on communities. So again, thank you for having me here today, and I'm looking forward to the discussion, to hearing the concerns and seeing how we can move forward. So I'll pass it over to Kathy now.
Thanks, Christine. And I too want to thank you, Mayor and Council, for the invitation to come together today. And I feel like I need to just start off by saying I know how frustrated you've been in trying to get this meeting together. And part of it, I feel like I need to apologize. I think I've been the weakest link in terms of my calendar and trying to carve out the time to have a meaningful discussion. That said, I think we're in the right moment in time as we face these two public health emergencies. We're moving into a different transition phase of our pandemic response, where many of our efforts have been focused over the last 2 years, knowing that this virus likely isn't going away. We have to normalize that into our daily work. And the public health emergency with respect to toxic drugs remains with us and is actually even worse than it was 2 years ago. And so this is the right time for us to look to new ways and start a bit fresh to say, as we come out of pandemic and go and really focus on this problem that's facing our communities, those who are vulnerable, those who use, and also, as you rightly say, the whole public safety, all of our citizens. What are the new ways what are the new approaches we need to bring to this, I call it, wicked problem? So some of the things that I think in terms of timing that are right now is we have a relatively new medical health officer for the region, for the Central Island, Dr. Sandra Allison, who I think you've met once before. Sandra came to us in the middle of the pandemic, is a well-established leader in the public health world. And what we hope to do is just bring some recent information into the conversation today around what we're seeing in terms of the numbers of people who are impacted, as well as the services that are being provided. And you are so right in saying there are gaps in our current service delivery. And as substances change and the mode of use is changing, our services need to change too. So if we could, Sandra has 3 slides that have some current information. I know she's calling in from her holiday, so she may not be on camera, but I want to thank her for taking the time to call in to be part of the discussion. So I'll hand over now to Sandra just to walk us through those 3 slides.
Thank you so much, everybody. Are you able to hear me all right? Excellent. And I apologize for any misstep because I was on a Teams meeting waiting for this to start. And so here I am, so glad to be here. First and foremost, I would really have loved to have been there in person, and I have full intentions of coming and meeting you all in person in the next coming months. And so perhaps I'll reach out to Kiva and we can make sure that we have that scheduled and fixed time in the future. So Kathy introduced me and the topic. So if we could move to the next slide, whoever is running the slides, thanks so much. Speaking to this slide, this is the EPI curve for the province of British Columbia, and it was released yesterday by the Coroner's Service. And there's an enduring and escalating public health emergency of deaths due to overdose and drug toxicity in our region and the province. The situation has been exacerbated by the COVID-19 pandemic due to increasing poisonous and toxic drug supply, toxic mixtures of drugs, and more people forced into isolation, using alone because of fear, stigma, and isolation. The release of the coroner's report for the deaths related to 2021 was released on Wednesday, and it was remarkably higher than last year. It's the highest rate of fatalities ever in British Columbia due to drug poisonings. In 2021, in the province of BC, there were 2,224 suspected illicit drug toxicity deaths, and that's a 26% increase over previous year, the year in 2020. For Island Health, that was 370 deaths that we experienced in our region. I had a look. That's the equivalent of 2 Airbus 320s being crashed, just to understand the absolute magnitude of this in our region. And when I quote these statistics, I like to remind myself and those that I'm discussing with it, behind these statistics are real people who have dreams and aspirations, parents, siblings, other loved ones. It really is a true human tragedy. And while the crisis has been enduring since it was declared a public health emergency in 2016, there has been one key shift, and that is the method that people are using to consume illicit substances. In 2016, the primary method of consumption was injection, and over time since that period, more than half of people who consume drugs smoke or inhale their substances at this point. This is changing how we respond to the crisis and the services we provide. May I have the next slide, please? This data is local data specific to the Oceanside area. In the Oceanside area, there were 16 deaths recorded in 2021. And you can see the rates varying over the years of the toxic drug crisis emergency that was declared in 2016. And you can see that the rates have been climbing with almost maybe a stabilization in 2021. You can see also that the North Vancouver Island Health Service Delivery Area has seen the most significant increase in rates. And the next slide, please. With regard to our current services, substance use is prevalent across every community, and we've pulled together this information so that we could maybe set the context for the discussion, as well as help identify some gaps. And so from our quick review prior to the meeting to ensure that we had excellent information for the discussion, we have understood that residents in Oceanside had 500 new encounters with substance use related community mental health and substance use service programs in 2020 to 2021. That's around a 48% increase compared to 340 visits in 2016 and 2017. These encounters were made by 330 unique clients. That's a 15% increase compared to 280 in 2016 and 2017. Specifically, the utilization of adult community addiction services increased by 86% between 2016 and 2021. In 2021, it was accountable for 65% of all the substance use related community MHSU or mental health and substance use services. Substance use outreach programs were accountable for another 10% of client interactions. Admissions to detox program by residents of Oceanside decreased by 45% between 2016 and 2021, from 58 admissions to 32. Wait days for the detox service increased from approximately 10 days in previous years to 18 days in 2021. Acute care admissions to the residents of Oceanside due to substance use problems increased by 84% between that time, from 56 to 103. Most of those were admitted to Nanaimo Regional General Hospital. In Island Health, partners provide a wide range of services, many of them locally, including harm reduction and early engagement intervention services. We host those in a number of places, including the Family Place Resource Center, which houses multiple agencies, which you're well aware of in your community. And these services include Island Health Public Health, Youth and Family Services, which provide public health services. And the services include harm reduction engagement with public health nursing, one-to-one education with clients and referral to services, including mental health and substance use, outreach nursing to local sheltering motels, harm reduction supplies distribution and collection, and also clients are provided direct engagement with a public health nurse on site. Outreach nursing is also provided to the new motel in town serving as a shelter. We also have services provided by Nanaimo and Area Resource Services for Families, or NARCIF. They're a contracted service provider funded by Island Health. They provide mobile outreach, substance use and sexual health harm reduction services, client engagement, referrals, and point-of-care HIV testing, and supply distribution and collection. They provided us some data for the last 2 years, and between 2021 and 2020, they've provided almost 4,000 harm reduction client education discussions, almost 1,500 naloxone trainings, and given out nearly 100,000, or collected 100,000 syringes, and had over 3,600 client interactions in those 2 years. Island Health Mental Health and Substance Use Services, addressing people on the treatment of the side of the spectrum. We have the outreach team. They were created in 2020. The team serves the broader Oceanside area, but significant areas of work for the team are in Parksville. The team goes where it's needed, including regular coverage of places where vulnerable people are, such as the soup kitchen, Orca Place, encampments, and sheltering sites. The team consists of nursing, substance use counseling, support worker, and peer support. Services provided include support, linkages to detox, treatment, and other services. The team supports approximately 60 regular clients and many more opportunistic encounters. We offer walk-in services, and all our mental health and substance use services are self-referral. There is no need for referral through primary care. Walk-in services are located at Oceanside Health Center, and the hours and services have been expanded over the years, and they're now available 5 days a week, 10 a.m. to 6 p.m. Access can also happen through calling the substance use line. The walk-in service, Oceanside Mental Health and Substance Use Service, provides counseling, crisis response, joint visits with substance use outreach team, RCMP liaison, and many other connections to our community. Regarding access to addiction medicine, I think you all know Dr. Cleland. Jane Cleland has a long-standing relationship with the local Island Health RNs and the teams that work in the public health space, and they provide support to clinic and clinic clients. Addiction Medicine Clinic is open 1 day a week. The Island Health Mental Health and Substance Use team also supports the work of Dr. Cleland through case management and follow-up between consults and supporting access to treatment. We also refer to and work with the AIDS Vancouver Island OAT clinic in Nanaimo. Dr. Cleland serves many patients, recognizing clients come on and off service depending on where they are at. Clients overlap with the substance use teams as well. Approximately number of clients on OAT in the area is about 120. We do provide indirect substance use services. We've implemented a successful shared care model in Oceanside, where a psychiatrist provides consultations with general practitioners and nurse practitioners, as well as psychiatry, seeing clients in GP and NP offices. This is an important way to address gaps in psychiatry due to Canada-wide shortages and supporting GPs to manage more complex care. Other services include crisis response, counseling services, psychiatry, assessment and treatment services, assertive community treatment teams, outreach for mental health clients. and strengthening our partnerships, which are extremely important and at the foundation of our ability to respond effectively in community. There have been significant investments and improvements made in mental health and substance use service system, from harm reduction to early intervention programs through to engagement and eventually, if the client is ready, treatment and recovery. The result of this work is increased awareness of safer drug use, reduced disease transmission, and early engagement and connection with service providers for eventual access to healthcare services, including treatment. So that's all I have to say about the services that are in place now. But we recognize, as Kathy had said, that there's a number of gaps. And we've been, let's say we had our hands full for the last 2 years. And I think coming out of the pandemic, I'm really keen to ensure that we're working closely with community and all relevant stakeholders to address these community concerns effectively. So I'll stop there. Thank you so much, Kathy, for giving me the opportunity to speak today.
Thanks,
Thank you.
Sandra. Yeah, I think we're ready then just to listen to you. And I think this was the opportunity that came together, really, was to hear from you, hear your concerns as you've opened up with Ed, and then hear from others. What are you seeing as opportunities for us to work together in partnership with those partners who are so key to us to try and address those concerns that you have as a community?
Well, what I'd like to do is open the floor up to the counselors that are here. So if anybody that wishes to speak, please just let me know and we'll go from there. And don't be shy. Just step forward. Counselor Fraz, Adam.
Yeah, thank you. And thank you for having the time to meet today. I appreciate having this chance to speak one-on-one, and like as you mentioned, having the open mind and looking for that common ground. I'll jump right to answering your question as far as where is it that you think there's that room for that common ground, and what does we like to see? I know for myself, a question that I've wanted to been asked and have an answer to for so long is regarding the needles that get distributed in the community. You know, one of the things we see often is when somebody is using out on the street, that they often discard their needles inappropriately, and they're left with piles around there. As an example, just this last week, when I was walking down the Jensen Greenway Trail, just beside the trail, there was a pile of needles left behind there too. So, you know, it's commonplace, and I think everyone's had a little bit of exposure to it. And unfortunately, by the Jensen Greenway Trail here too was within a stone's throw to a lady's house who actually had a needle prick just a couple years prior. So the question that I want to ask and is I'm sure everyone has seen the vanishing point syringe that's out there. These are the needles that are offered in the naloxone kits as well. This needles I got from VHA as well, and so they're one that you guys have access to and use in certain scenarios. And for the benefit of, you know, those who aren't aware with it, with this syringe, the benefit that I see is once they get used, you know, they'll inject their substance. Once the syringe is used, the needle retracts right into its own casing, and it becomes its own sharp container. You can't get injured by this. And I think when it comes to reducing the stigma, which is a goal that I know is everyone's goal here in the community, the stigma is really largely reduced when people aren't fearful for their own health of improperly discarding needles out in the community. I see this needle as being a real solution and part of that common ground strategy. What I understand a lot of the ways that needles get distributed and how the harm reduction model is saying, well, we don't want to limit the amount of needles so that people aren't encouraged to reuse needles. And for myself, in speaking to people on the street, I've interacted with them, heroin users, and I've asked them, do you have any objection to these types of needles? And in particular, a young female I was speaking to, she said, no, I actually prefer those needles because in a group situation, there's no pressure to share a needle or to reuse a needle. And so there was a lot of buy-in in that regard. I get that the cost can be a factor in it as far as these are more expensive needles. And if you were handing them out exclusively, that would not always be the most efficient method. But where I think the opportunity lies is at the point of distribution, if individuals were asked, do you have a fixed address or are you housed? You know, meaning, do you have a place where you're going to be using where it's not on the street? I don't think it's inappropriate to have the traditional needle. But if somebody does not have a fixed address or they're not housed, for them to have access to the vanishing point needle, it provides that safety for the community while also providing the safety for the user as well. So that's where I think there's an opportunity for common ground. And I ask you guys to have an open mind to considering that. Can these vanishing point needles be part of the solution? And I guess I'll leave it at that for now and turn it over to other counselors or to hear your feedback. And then and perhaps I have some more to add to that afterwards. Thank you.
Would anybody care to comment on Adam's thinking towards the vanishing point needles?
Maybe I can start, and I don't know if Dr. Allison would like to weigh in. I thank you, Adam, for raising that. I know one of the discussion points in the past has been that most of those retractable syringes are used for intramuscular injection rather than intravenous. That said, though, like we need to regroup on some of that, because that may be, if you've done some kind of what I would call market testing, we need to do the same. So I think part of what we would look towards is a way in which, like our community action team, which has relationships with users, could we bring them into this conversation to say, would this work and in what circumstances? I think you've raised a really good circumstance that it may apply, so that we change process in a way that the users are part of that change. So I think, you know, I would say at this point, we need to be able to set the table with all of the players, the partners, including people who use, to have this kind of discussion to say, what will be the difference that makes the difference? And I don't think, you know, from a principal perspective, if that is one of those differences, I think we need to be open to that as a health authority. The point here is to keep people safe. Those who use and inject substances, to keep them safe. And as you say, to keep the public safe. So I think this is it needs to be done in partnership around a table like our community action team that has the right members. So I don't think it's an Island Health decision alone. I do think we need to involve our partners in that. I don't know if others on the call would like to comment.
I think you said it perfectly, Kathy. Yeah, I think that we've got some work to do.
Thank you.
If I could just make a comment there too as well. You're correct when you say about these vanishing points. These ones is particularly coming from the naloxone kits being for intramuscular, and it's because of the gauge of the needle. But they are able to also be in a different gauge so that they can be as an IV needle as well. And the other point I just want to make is that I really do think that these are a step towards that reducing the stigma portion of the puzzle, because I truly believe there'll be a lot more community buy-in when people aren't fearful for their own health, right? It removes that, you know, it raises that anger emotion, and then that anger emotion starts to look for somewhere to place blame, and that's what becomes that roadblock towards reducing that stigma. Thank you.
Thanks, Adam. Marilyn, you had your hand up.
Oh, thanks, Ed. And thanks everyone for your presentation, for listening to us. And I thank you, Adam, for bringing that forward. That was one of my concerns, was that the vanishing point needles are already in the naloxone kits. So that always mystified me as to why, if they're in the naloxone kits, why you can't use them. But I guess and I like Adam's idea of perhaps having some sort of compromise whereby the folks who come to get these kits or these needles have to give their address or some way of differentiating between those who may not have a home and are going to perhaps discard those needles in the community. My comment to that would be there might need to be some other sort of oversight to that, because people might make up an address or whatever. But anyway, thanks so much for those comments, Adam. I think you said it very well.
Doug.
Thank you, Ed, and thank you very much. And Sandra in particular, I really appreciated hearing all the treatments and processes that you've put in place relatively recently, as in 2020. I was not aware of the outreach program that you had that actually went in Oceanside where needed. And we really appreciate that, because you know the centers where that's needed, and you're hitting those. And thank you for that, because you have the experts that can deal with this. Christine mentioned in her delivery earlier that I appreciated. She mentioned that the times as we're transitioning out of pandemic, we're actually getting into a different time as well. And she mentioned about the substances changing and the mode of use is changing. And I wanted to touch on that a little bit, because it kind of jives in with a story in the Globe and Mail recently anyways, advising that the addiction crisis is being taken over, or there's a real trend towards the synthetic drugs. They're being manufactured in pill form, to keep it simple, the fentanyl and so forth, and that they're being made in the drug labs, and thereby eliminating the plant, thereby eliminating the injection system being by needle, because they're going to be taken over in pill form. And so these are already being widely used on the market. They're in North America, it's coming through the Mexican group, through the United States into Canada. Have you seen any, because your numbers are just staggering. It just blows me away, the deaths that we had in this last year. But you've also mentioned the fact that this is from people of all facets of life. These are people that are getting out of pain addictions through injuries and trauma and stuff like that. But now they're being unfortunately, the traffickers have recognized the market, and they're going to pick up on this. And so what they're doing is they're making the synthetic drugs that are actually less expensive and so forth, and they're easier to use, because as Adam pointed out, that stigma is just not there, because it's a pill. In fact, they're already being marketed through the social media channels, and it goes on and on. So it's the story I read is like a good news, bad news. It's like maybe we won't be worrying about needles very soon, but unfortunately, it's going to be injected through pill form. So we might not be worried about the needle thing, but what I am worried about is the fact that there's going to be more drugs, and apparently they're even more potent than the plant-based product. And the current treatment methods are proving to be unsuccessful for recovery. There's a lot of psychosis and so forth that goes along with these new drugs. They're super strong, but they are also, the high doesn't last as long. So the user, instead of getting by on 2 to 3 days, now they're actually doing daily usage. And it just makes it better for the traffickers, and everybody knows it's all about money. And so I'm just wondering, have you run into this at all? Has this started hitting the Canadian market yet? Are we looking at this opioid crisis as evolving into still a crisis, but actually maybe even getting worse? I'm not sure how you're going to handle it. But so I'm just wondering if that's coming into this equation as well. Instead of just needles on the ground, we're going to have even more victims of this crisis. Is that where we're going?
I'll speak to that. Thank you so much for the question. Absolutely, we are seeing it worsen. In fact, I saw a quote: as soon as you make one drug illegal, another person will deliver a more toxic drug right after it. And so we do need to talk about safer supply. We do need to talk about decriminalization. MP Gord Johns has Bill C-216 in front of the Parliament for a private member's bill to really address this aspect about the legalization or decriminalization of substance use. Definitely, once we made changes, even regarding prohibition of alcohol, it changed the landscape for the black market. And so it's something that we do need to work on. Regarding novel substances that are found in the region, absolutely. I'm getting reports of novel and strange substances all the time, and one that's really concerning is called xylazine, and others that are benzodiazepine that are contaminating the supply. There's a lot of concerns regarding unregulated substances in our community, and I have to say that we will have to change how we're doing things, change how we do things in a community, and how we respond together to address this, because without working on this together, we'll just see this continue to get worse. And maybe I'll invite Christine or Kenneth to talk about this, because this is a really large problem.
Yeah, I think it was actually Kathy who was speaking about that in her opening comments, but yes, you're well informed about the emerging trends we're seeing in the illegal drug supply and the increasing toxicity of it and how it's evolving. And it is something we're paying attention to because it is affecting Canada and particularly BC and the West Coast around the increasing danger of the drug supply.
Thank you. One of the benefits of being a leader, isn't it, in British Columbia, leading the way instead of following. Teresa.
Thank you, Your Worship, and thank you everyone for being here today. I'm going to share something that very few outside of my family know, is that my brother passed last year. He wasn't a regular drug user. He wasn't a needle drug user by any means. The toxicology and that I couldn't even begin to understand, and that as I'm not a medical practitioner by any means. But we know that mental health is a major factor. His daughter is 4 today. So my meeting with you here today is very bitter in some ways to me, that he could have been helped in some way. But I'm going to go back to the fact that we do have services in our community. We have stakeholders, we have partners, we have community action teams. This council has put forward a bylaw that I think that Parksville could be a test area, to be honest with you, to see results in our community and going from there, and hopefully going forward across the province. I know that Gord Johns, I've spoken with him in the past, has talked about quite a bit of different areas that we could lead and hopefully change some of the conversation. I know that there's some walk-in services and everything available here, and I'm hoping that we can expand and lead in some ways. Parksville is a very small community in some ways. It's 13,700, I believe now. But we're growing, and I'm seeing our community drastically change. I had a small cafe and catering shop in the downtown core, and I loved my courtyard and had a lot of herbs and different flowers and things like that. But it got to the point that no one was allowed to work in the gardens or anything because of the amount of needles that were found in the bushes and everything that were dropped down from the sidewalk and down below into the courtyard. I also found on 2 occasions bags of needles and drug paraphernalia in our garbage receptacles. And being in the downtown core, we did have a great deal of homeless in the area, and that would sleep in the corners and under shelter, and that on our property. So those are some of the comments of things that are happening in our community and outside of our community. My brother was in Vernon, but I have two grown adult children who are in the next stages of their life and thinking of children and staying in our community and wanting to raise their children in this community, and for others to come here, and that I want them to absolutely feel safe. It's if we were looking at this, I was looking at some of the stats and everything back when my children were younger and everything, and where it started to rise, the numbers of everything that where we're having a health emergency. And it's all across the province. Don't get me wrong. I know that it's all across the province, but I'm hoping that Parksville can lead in a small way and have those conversations and have that partnership and really work together. So thank you.
Thank you. Councillor Chandler.
Thank you to all, and through the mayor, just wanted to thank everybody for coming today. I'll be honest with you, I'm quite pleased to see how many of the community health people are here, and minister, and it's really overwhelming to see the support here. So I really thank you. It's a great turnout. I just want to touch upon a couple of personal things. I have a brother that's 68 years old. He's been a 15-year addict, moved to British Columbia from Toronto, and became an addict through his connections through downtown. He was a user way back in the day, but he was on speed back in the 1980s and uppers and things like that. But he never delved into some of the stronger drugs until he arrived in British Columbia. And he had a divorce and things went sort of sideways on him. So very typical. But I had a great conversation with him a couple of days ago. And just right from the horse's mouth, he's been in the downtown east side for about the last 10 years. He's been in and out of a couple of different SROs. He's been in some senior housing. He's been on the street, lived in Oppenheimer Park. And so he would be what you would consider one of the veterans down there, not a war veteran by any means, but a veteran of the streets. And what I want to share with you today is something that he told me that was really kind of scary to me. I realize we're talking about needle distribution and we're talking about a bylaw, but I just want to talk about one piece as well that, you know, obviously we have to do that, the harm reduction. I think what we got to look at is when we talk about harm reduction, I think we also have to look at the harm reduction of what happens when people are kept in addiction for a long period of time. And one of those things that happens is something that he shared with me. And he said that in the system, there's a whole hierarchy of the vets and the people that are all involved. And what they're constantly doing is trying to recruit new people that have a new income stream, because that's what they need to keep going and get their drugs. And so the concern of mine is that as we allow this to continue and, you know, trying to harm reduction as our main source is great. I appreciate that it's saving some lives, but I think in another note, I'm going to be the person to say that I think we really need to start considering the fact that we need to put the biggest percentage of people into some sort of detox treatment and rehab system. And I won't get into the politics of how I feel about the free supply. I think it's needed in some situations, but I also think that it exasperates a certain amount of drug use and creates new users, therefore creating new, what we call recruits, if you will, or what he called recruits. And I think that's what we got to be fearful of. We're creating this new subculture of legal drugs and available drugs. Now that they're widely available and in different test patterns and different periods and places, I'm concerned that we're going to create more and more drug users, which again, fans out into maybe 5 people a year is what he said is the recruit scenario, just because families run out of money and then they move on to somebody else with a new family. So anyways, I apologize for getting into that subject, but I like what Adam has also said in regards to the retractable needles. I appreciate your time today. Thank you very much.
Thank you. If you don't mind, I'm going to just take a minute or two here because we've got 2 different directions going, and I understand that they're both interwoven, but the whole purpose originally was the danger that carelessly discarded needles cause in our community. And that's really what I would like to focus on as to what are some of the solutions of that will fix that in our community, so we don't have people having to check the beaches, having to check the volleyball courts or the grass in our parks and so on, or in the alleyways behind the shops in the downtown core. We need to talk about how we're going to fix that. Adam brings up a really good point. Doesn't matter if it's a piece of plastic laying there and it's not dangerous because the needle has been taken inside. That certainly goes a long ways to accomplishing what we tried or wanted to accomplish with this bylaw when we started. Interesting thing is this bylaw was unanimously approved by council. We all were adamantly in favor of making this happen. I think part of what we have to address, though, is the fact that all of our solutions wasn't aimed at all drug users, because that would be totally unfair. There is only a very small segment of the drug users that are the ones that carelessly discard, where they take their injection and then drop the needle where they are and go on from there, or drop bags of needles because they're tired of carrying them around. We have to look at how do we fix that. That is really what we're here for today, is how can we do this? Teresa brought up a really good point. We offered to Minister Dix and said, look, make us the guinea pig, make us the test for this. Let us run with this a little while and see if it works. It can't be any worse than what's been happening over the last 2 or 3 years. Let's see if we can pull some of this together and come up with it. We can't fix the problems that everybody's talking about. We don't have enough money in the city of Parksville to address the actual drug use here. What we can do is address what happens after the drug use and the discarding of needles from that small group that drops them all over the place in our community and makes them a danger for our community. When it hit the paper 2 years ago about a child being pricked with a needle, that's all it took, and it just all hell broke loose, quite frankly, for a couple of weeks talking about this. Oh, I've seen them here and I've seen them there and so on. It just never got any better. So I'd really like to see if we can talk about what can we do? What's the minimum that's acceptable to the ministry and to Island Health at this point in time to accomplish what we need to have accomplished to make our constituents happy and to make you accept the fact that we're not here trying to reduce the number of needles going to the users. We're not here to do anything but make it safe for everybody. And I'm hoping that's what we can come to the table with today, or at least start us down that pathway. So I throw that back out on the table.
Yeah, I think, Ed, one of the things that we were just talking yesterday, and I think building on what Sandra and Kathy said, the balance of harms there, which is the harms to the individuals, and then the real harms that you're identifying then to the community. I think the Sandra's notion of really working with the local team, working with you, and then specifically looking at the immediate concern, which is how to actually address the discarded needles and see what options there could be, practical options that could radically reduce that, including exploring what you've raised, Adam. I think is something that we could really focus on. And I think that's what Kathy was very much thinking about in terms of how to move locally. And then we could have a follow-up. So it doesn't just go into having got us together, that there is some local discussion with the action group, with the people, individuals close to this, and see how there's some practical solutions that we could actually advance this. Also, I also want to just acknowledge what Teresa was raising, and also Mark, what you just said with the examples you gave. You know, it's very much a discussion that we're having as well, Christine and I, with the teams, which is that we've got to get a balance of the harm reduction is a critical strategy, trying to reduce what Sandra pointed to, which has been just an horrendous level of death. But the balance of that has got to be, how do we get the treatments in place that actually help people early and quickly and engage them. And I think that's something that, you know, your point is really well taken. It's something we're actively looking at about we've got to get a better balance in terms of more active intervention and treatment to help people get away, not that we're actually just continually and building out through the harm reduction, just continued. So I think it's a really important point you're making, but to what you just said, Ed, the immediate and pressing concern for you is to really try to look at this discarded needle issue. And I think if we could get some action on the ground close to where the reality is and say, what are the practical things that we could do together, being with our partner through Island Health and yourselves, to really look at reducing that and trying to, as far as possible, eliminate that issue and see, can we make some progress, and then touch base in a matter of a month or a couple of months to say, okay, are we making any real progress there? And it's not just left in abeyance. I think the issue that the Minister Digg struggled with, is it is that balance, and no challenge to the good intent of the bylaw. There was strong advice to the Minister that the balance was too much in terms of that actually reducing access to that could be the impact, which obviously that's what you're articulating absolutely was not the intent at all. But I think if we could work together to find some of the practical solutions to get to focus on the discarded, that will be, you know, a very practical thing to do. And then I think, to what Sandra was saying at the beginning, really engage also at a community level about how do we make sure we get individuals linked to the kinds of treatment services and help that will really help them move away from the dependency and the risk that they're exposed to through the hazard of the use of the illicit drug supply.
Thank you. I appreciate it. One of the things that I'd like to point out is we certainly don't want the concept of the discarded needles being the tripping point for, you know, the other great things that all of you are doing and all the organizations in town are doing. Those are very, very important. And we don't want that to be slowed down, stopped in any manner whatsoever. We just want, so I guess my question is that, what is the very next step and when? And because that's just kind of the way I like to work, is to know what's going on next. And so, you know, if we can come up with some kind of an agreement that we can get together soon, because we're going to get down the lane here, and you know, we're what, 5, 6, 7 months away from the next election, and it's no different than in any of your worlds. When you start getting closer and closer to elections, you know, these things will start getting put off until after the election. And really, we would like to see if we can get at least something started for the people of Parksville before the summertime, before the tourist season, when 40,000 people are walking around, you know, in the area. So anyways, Marilyn, you had a
I think
question.
Kathy, I mean, you had some thoughts, right? Because very much the same thing you're saying, Ed, is what Kathy was saying yesterday, of really getting something, what Sandra was alluding to, getting something going immediately and fast, and get some action going here in a collaborative way. So Kathy, do you want to?
Yes, thank you. So I think what I'd like to propose is that we at Island Health, as one of the partners at the community action team, because I think Steve has just used the term action, local action, which is what we need. Each community through the public health emergency has been asked to mobilize a community action team. There is one in Parksville. I think it's probably waxed and waned in terms of the energy, and I think let's try and rally some energy in the next month. And Island Health, we will put resources that we can, including our local leadership from public health and mental health substance use, at that table to explore as Adam's idea, as well as, to your point, visible containers so that the public can see that they can drop things off. So in locations in the community. And I know immediately our team is putting one outside the Oceanside Health Center, I think in the next couple of days, so that members of the community, not just intravenous drug users, diabetics who have sharps at home, who need to dispose of them, can use these containers. So, but around specifically discarded needles with respect to harm reduction, that community action team, I think if we can mobilize that in the next couple of weeks with this specific call to action, and as Steve has mentioned, I'll be looking for an update from my team to say what's coming from that work. And if we have to pivot on that with another plan, then we'll do that quickly. We won't let it go too long. But I think just as you all have identified, focusing this on one thing and getting some success, I think will be very helpful. And with respect to the bylaw, maybe we deconstruct what are some of the elements in there that might be worth trying through this community action group. I feel strongly that the partners need to have a voice in that in order for it to be successful. So I really think that table is probably our next best step to decide on the actions that will be most appropriate.
I hear you and I appreciate your comments. I really do. Thank you very much for that. We would like to have somebody sit at that table. Okay, if it is one of the council, we can appoint a liaison if need be for that. That would be a start at least, and then we can at least have direct communications. Third and fourth hand doesn't work, so we'd appreciate that. Councillor Wilson has a question that she's.
Well, it's Marilyn, but thanks, Ed. I was invited by Sherry Thompson to sit, and I've had one meeting there. So my question though, and my concern is, why is it prohibited, or why do you not just automatically use vanishing point sharps? What is the sticking point with this? Can somebody address that?
Well, I can just say that when that question was brought to the users through the community action team previously, what we heard back was that the folks that were engaged felt that they would not use those needles. Like I said, that was then, this is now. I think we need to bring that whole conversation back for all the different reasons. And I think Adam raised a very good point. It may be who we're asking. So we may have to find a different way to consult. But I do think the effort to go to change the process around harm reduction supplies, if it's not going to achieve the outcome, I would hate for us to go down that road without consulting the folks who use the services. So I think that's that's why I'm not comfortable from an Island Health perspective, changing that kind of policy without consultation.
Well, I think to the point you're saying though, Kathy, and to the point you're raising, Marilyn, you're also not hearing from us some kind of an ideological position from us as well, saying that's not. And I think Adam's point at the very beginning is well taken. So as Kathy just said, let us collectively take another look at this issue, and we'll absolutely, with an absolutely open mind, look at this issue and try to understand better why that was the position taken, or proposition put forward, because that was part of the proposition that was put forward in respect to your bylaw. So let's have a fresh look at that with an open mind and see whether we can get to a conclusion on that, based upon really looking at it in a serious way.
Thanks for the answers to sort of answers, but thanks for the promise that you're going to work on that. My other question is, thinking of this problem federally, how does it work with other provinces? Do they use vanishing point needles, or is it something that the federal government can work with us on, or work with you on?
Christine, do you want to give a comment on that?
Yeah, I mean, I'll look to Island Health to see if we're in line with other jurisdictions. And I think we can probably find a way to resolve this locally. I don't know that we'll need to reach out to the federal government, but we'll definitely look to make sure we're aligned with other jurisdictions, as you suggest.
Thank you.
I do know.
Oh, sorry, go ahead.
I was just going to let you know that we have an expert on the call with us in Ken, and I'm sorry, Ken, I don't want to put you on the spot, but I just have, who is also very well versed in the evidence around the delivery modalities. And so, Ken, I don't know if you have any advice or any information you'd like to share, especially with respect to how we compare to other jurisdictions in terms of our harm reduction strategy.
Thanks, Kathy. I haven't done a recent jurisdictional scan, but I believe that sort of best practice established nationally and internationally is to provide the kind of services that are most amenable to the clients who are receiving them. The BC Centre for Disease Control has a provincial program that distributes syringes throughout the province to all the agencies, all health authorities and community agencies, that in turn provide them locally. And they do a client survey on an annual basis. And the question around retractable syringes has been brought up through that client survey a number of times. And it's, I think, fairly, I won't say unanimous, but preponderance of clients say they would not want to use those. And that's been the basis for this decision. But certainly can re-explore that question. We can talk to BCCDC and think about other ways to consult and explore options around that.
Thank you. Thank you very much, Ken. Appreciate it. Somebody, I'm sorry, I didn't write down the name beside who made the talking point, but somebody recommended the idea of taking the bylaw and pulling it apart and seeing what can and can't be used out of that. That's what I was kind of hoping that at the end of the day, this is what this group would come up with. And maybe it's just two people from the health side and two people from the city side get together and let's go through it and say, yeah, that makes absolutely no sense based on X, Y, and Z. And yeah, we can work on this, or let's send this one back to that group to be investigated further, going around and talking to the users or whatever. I think I would really like to know, is 80% of our bylaw full of beans and the other 20% is good, or is it 90-10, or, we need to know what we've got to work with and what we're hoping you're going to work with at some point in time. I mean, we didn't just, as I said earlier, throw it up against the wall and hope it would stick. There was a lot of careful thought from our group here as to what we wanted to have in our bylaws, understanding that we were stretching in a few areas, but at the end of the day, there's a lot of good points for our community. It's what our people, what our constituents wanted. And so that's where we are. I'd like to go along with the committee that you had there, but I'd also like to see us take, 4 of us or so, take our bylaw and say, yes, this works, no, that doesn't work, type of thing, and see where we get to with it, and then delegate it from there.
So Kathy, that was your idea. I mean, that's something that, and I'm sure, you know, with people like Ken and through Christine, if there's any individuals from the ministries that could be of help on that, that would be, I think, a practical thing to actually also come out of this, to do that as a separate process, eh?
For sure. I think city staff, our staff, and some ministry expertise could huddle around that. That I think is another concrete step.
With this great thing called Zoom, you know, I mean, we can get together without actually having to drive 80 miles each way to get to a meeting. So I think it works, even if it's for short bits and pieces. I'd like to see what we can come up with sooner rather than later on this. Marilyn?
Oh, thanks. Just one more thought as to the vanishing point needles. 2 things came to mind, actually. One is education. Perhaps this is to Ken's point, that they did a survey of the users to see how they felt. Perhaps there needs to be education as to how to use a vanishing point needle. The fear of it, perhaps, I don't know. Unfamiliarity. The other one is if there are only vanishing point needles, there would be no option then, and they would learn to. So just a couple of thoughts.
Doug?
Thanks, Ed. And I think the bottom line is, here's our community is looking for a lesser amount of discarded needles in our community. And so you've proven the fact that we can work collaboratively together, and you're doing your part already by increasing, you call it your outreach team is out there. So if we have more people receiving services and treatment, then there's going to be less needles discarded. And I think that is a good part of the formula that you are already concentrating on. I'm just wondering, is there any room, or do you have, I know we all deal with budgets, but is there any room to maybe step up that program to get more treatment to those people that are actually discarding those users? Is there any room for that? Or are you, do you have limitations placed on you as well?
Going for it, Kathy. I mean, there's always limitations, obviously, but to the point you're making, we're actively looking at how do we better utilize and develop the programs on the treatment and the outreach side to actually reach people in a meaningful way and work with them. So yes, there's room to explore some of those issues. Yeah, I think, Kathy.
Yeah, and I'll just build on that. We currently have a request for proposals out for supportive recovery, that 5 to 6 supportive recovery beds for the Oceanside area. So we're actively soliciting proposals for that right now. So absolutely, there is room for more treatment. I do need to say what we're finding in our health service delivery, probably not unlike any other area, is our limiting factor is now the talent, the expertise and talented human resources that we need in mental health, substance use, in cardiac care and cancer care. We are finding we're in a worldwide shortage of healthcare workers. And so, so now that's what our limiting factor is. It's not so much the funding. Our ministry has been very generous, and we've had with the decampment funds that we've had in the South Island, we've had significant investments in mental health and substance use over the past year. So it's not so much a funding conversation. It is about a health workforce challenge.
Welcome to the world of the future. Yeah. I think we're all going to be seeing that for just about every function in life these days coming up. Anyways, anything else?
If I may.
Oh, Adam, sorry.
Yeah, thank you. I I want to have another question to ask, and just a short explanation of why I'm asking this question. Prior to myself being elected to council, when I saw the rise of needles throughout the community, when I got concerned about it, I wanted to understand what was going on. And I'm the type of person that I want to speak from experience. And so I had gone to Oceanside Health Center and asked them for needles. I wanted to know what that process was like, and
Oh, you froze. Yeah, just give you a second, Adam, see if you get back online here. All right, well, he's frozen. Mark. Go ahead, and we'll get Adam. He'll probably.
Thank you, Your Worship. It's a great conversation on the.
There was quite a.
Hold on for a second, Adam. You were gone for a while. We moved over, so we're going to bring you back.
Hi there.
Go ahead.
Sorry, I'm not sure at which point that cut out there.
You were gone for a while.
Okay, so
Your last comment, Adam, was that you went to the Oceanside Health Center to see the process.
thank you. So I went to the Oceanside Health Center, and what they provided me was a bag with the needles and the literature in there of safe use and so on. It has a bit of the drug paraphernalia, and then I also met up with an outreach team downtown in Parksville. I was aware of the work that they were doing there, and I wanted to see what that interaction was like with them, what the process was for handing out needles. So I went to them and asked for it, and they both had their different ways of doing them, but I got to say they're very professional. It was a great experience as far as the interaction. It was very comfortable and so on. But the thing that was concerning for me was 2 points. One, with the outreach team, when I asked them if I could have some needles, the response was, "How many can you take?" It wasn't about how many do I need or what's, there wasn't a discussion around reasonable use of them. It was how many could you take? And I was asked, can you take 100? Can you take 150? Can you take a box for them? And I was a little bit taken back. Oh, wow, this is quite a bit. And I asked them, well, what will I do with these afterwards? And it was my request to have a sharps container or something to have for the needles for them to be disposed of. And I realized throughout both these situations, there was never any discussion about proper disposal of the needles. There was no literature in the packages that talk about proper disposal of the needle. The concern was very much just on what the user needs are, but not on what the community needs are. And I really, so my question on this, and the thing I'd put forward as an opportunity here too, is including proper disposal education or some literature at the point of contact with individuals who are looking for needles, whether it's at the Oceanside Health Place, if they have literature inside the bag or some kind of, I do think actually over the years now, because I brought up this point a couple of times, that they put a little label on the staple to the front of the bag that says, please dispose of your needles properly. But I think there needs to be a little bit more of request and discussion with those users of what it is. Because even when you talk about having sharps containers in the community, that's not enough. It's not enough if there's just sharps containers. It has to also be reminded to the users of, to properly dispose of needles. Please don't throw them out in the community. Now, when I see people on the street there, when I see people using them on the street, they're fairly cognizant of time because of the community pressure that's come up, and they know that if they leave a mess, that it's going to create more of an issue. But I think at the outreach workers and the Oceanside Health Place, there could be an improvement there as to proper disposal for the needles. Thank you.
Thanks, Adam. Mark.
Thank you. Great points, Adam. Thank you for bringing that up. Just one last quick point. We talk about, trying to get people into treatment as soon as possible. And that seems to be a real challenge. And speaking to some of the local folks here, there's talk that it's really difficult to find a place to go. And they can't really get that availability of space. So I guess I got a couple of questions. We've got some infrastructure, places like the Comox Hospital, the prior Comox Hospital. I'm wondering if something like that, a couple of floors or a floor dedicated where we're not building something new, but it's something that's already there. And looking towards that sort of thing for the treatment. And it doesn't always have to be in our community. What I mean by that is it's best when we're dealing with people with detox, and which is a scenario my brother had gone through. He's right back in the same community again. It's best if we try to keep them out of this community that they came from, wherever possible. So I just want to mention that. I thought that there might be some opportunities with some properties and some existing buildings that we could be using rather than looking at 3 years down the road for building, because I think that's part of the stumbling block. Is it's just such a massive process to get going. Can we look at it as an emergency that it is and start to utilize some buildings that are there, just the way we did with COVID in some cases? Thank you.
Thank you.
Can I speak to that? Just
Certainly,
a quick comment.
please.
Thank you so much, Mark. And I want to just acknowledge both Teresa and Mark. Your personal stories of sharing about how this has impacted your family is really it makes my heart just sink, because I know this is affecting so many people in our region. And thank you for highlighting infrastructure, because we do know that there are successful models. And I'll give you one example, the Cowichan Wellness and Recovery Center, for instance, where the communities come together to provide safe space for individuals to access care and overdose prevention services. So these are the discussions that we really need to have in the community with the team and the local stakeholders to find those local solutions, including having people have a safe space to use, and therefore it does decrease litter in our communities. Thank you.
Thank you. Mark, you had a follow-up?
Yeah, just a fast follow-up, and I appreciate that. Thank you for touching upon that. I think the main thing is that we realize that here we've sort of stretched our capacity as far as having a couple of different places that we're dealing with right now with the supportive housing side. We don't really have the infrastructure available for that kind of thing, but I would love to see that in a more regionalized scenario where we have buildings like the Comox Hospital or something like that that could be used for that sort of thing. I think it's definitely needed. And I think, I appreciate the fact that you would be looking into that too. So thank you.
Any last comments? Almost 4:30 on a Friday night. I think we're getting there. Folks, I can't thank you enough for making the time to come and visit with us and have this conversation. It's very important to us. As you can see, we're all totally vested in this whole process. We want to make it happen. We want to fix the problems that we have. We're a growing community, and we have a huge tourist business that we don't want to jeopardize. But more importantly, we're really concerned about the safety of our residents and of the users, for that matter, as well. We want to make sure everybody is taken care of as best we can. So from that perspective, thank you very much. I'm really looking forward to seeing if we can get this little group together where we can look at the bylaws in specifics. And Steve, I'll leave that in your hands. Is that where I'm going to do?
Yeah, Kathy and I will talk and we'll get that underway.
All right.
Straight away, yeah.
And if somebody wants to contact me or
Yeah.
Kiva, either one, we'll make the arrangements from that. I know it's, like I said, it's a Friday afternoon and you probably had a million other things that you needed to do, but thanks. Thank you so much and have a great weekend. And we'll talk to you real soon. I'm looking forward to us getting together again. So thank you very much.
Thanks everybody. Really appreciate the time and the discussion. Thank you.
Thank you.